It's 6:15 now. It's a long-term chronic condition. New figures show there's been a rise of more than a third in hospital visits by heart failure patients in the last 10 years.
Yes, research by the British Heart Foundation found almost a fifth of those diagnosed are under the age of 65. And women often seem to fare worse. It's something 49-year-old Claire Barouche knows all too well.
I can walk about 30 metres on flat on a good day. I look relatively normal, I look relatively well. And it's very, very hard, even for, I think, close friends, to fully understand how debilitating it is living with heart failure. I think, had I, on the Sunday evening, at 1, 2 o'clock in the morning when I was feeling at my worst, I think had we have called for paramedics and ambulance then, the damage that's now been done to my heart, you know, leaving it 3 days, it wouldn't have been as severe.
Well, joining us now is consultant cardiologist Dr. Ramzi Khamis. So such a dramatic rise, seemingly, in heart failure in the last 10 years. Why have we seen that rise, do you think?
Well, Kate, the advances in treating heart attacks and keeping more people alive meant that there are more people alive who have suffered heart attacks in the past. That seems to be the biggest factor in the increase.
So their hearts are likely to be weakened by the attack, even though they have survived?
Exactly that. So when you have a heart attack or when someone has a heart attack, it's likely that the muscle of the heart is damaged. And if that damage is bad enough, then the patient may suffer heart failure. And all what heart failure is that the heart muscle is weak. And it's so weak that it can't pump blood efficiently around the body, and therefore the patients get the symptoms.
We were listening to Claire talk about her experience and how she's living with the problems that she has with her heart. And you've done some research which shows that women often fare far worse after a heart attack. Why is that?
Well, there is research out there. It's not our research, but there's research out there that says that women present with a heart attack later than men do, because a lot of the time the symptoms that women get are different to that from what men get. So they may have atypical symptoms, they may feel nauseous, they may feel dizzy, but they may not get the typical chest pain that is usually...
Is there a reason for that?
Well, that's undergoing a lot of study by different groups, but there isn't kind of a biological reason that's been found yet. But really,
instinctively, if you feel nauseous, you're not necessarily going to think, oh, I'm having a heart attack. No. The point about, I guess, is feel your heart's hurting. You know that there's got to be something wrong with your heart. I mean, that's complicated.
Yeah, so it's obviously very difficult. But the main kind of point to really to bring across is that the survivors from heart attacks has increased massively, and it's mainly due to better research, and a lot of that research is funded by the British Heart Foundation, where over the past 30 to 40 years, so many more people are surviving from heart attacks, men and women. And now it's the time to kind of just to get that better and to get the treatment for heart attacks better, so that people don't suffer from heart failure afterwards. There is a lot of efforts kind of in trying to find treatments for heart failures that may benefit people like Claire, and the BHF does a lot of work in that field. bhf.org.uk/find the cure will tell you all about it. But there are advances. There are some avenues in stem cell therapy and teaching the heart to repair itself in damaged hearts. That's probably the way forward in the future.
Okay.
Fascinating.
Thank you very much for joining us, consultant cardiologist Dr. Ramzi Khamis. Nice to see you this morning.
Thanks for having me.
It is 6:90. Now, new figures seen exclusively by Good Morning Britain have revealed the soaring number of patients stuck on ambulances because there's no room for them in hospital.
Yeah, in one shocking case, a patient in the West Midlands had to wait 9 hours and 13 minutes on an ambulance. We're joined from Norwich this morning by Lib Dem